urine, means a substance or mixture of substances that constitute an object in urine that forms in the kidney is called kidney stone or renal calculus. Next definition. A kidney stone is also known as renal calculus or nephrolite, is a solid piece of material which is formed in the kidneys from materials in urine. Then, ma'am, slide change. Ma'am, incidents. Ma'am, I already explained about definition. Incidents. More than 1 million cases annually in United States, in 1 in 272 or 3.6 per thousand Americans develop stones annually. Then the majority of patients are between 20 and 55 years of age. The incidence is also higher in persons with a family history of stone formation. Then recurrence of stones can occur in up to 50% of patients. Now come to related anatomy and physiology. Here you can see the picture of kidneys. The kidneys are a pair of bean-shaped organs on either side of spine, below ribs and behind the belly. Each kidney is about 4 to 5 inches long, roughly the then how now comes to types of renal stones. There are 5 types of renal stones. First one is calcium oxalate stone. This is the most common type of renal stone, and it is caused by supersaturation of urine with calcium and oxalate. Then calcium oxalate tend to form in the alkaline chemistry, and in this type of renal stone, uh, uh, we need to avoid high in oxalate foods such as beer, spinach, etc. Then next one is calcium phosphate stone. Uh, it is caused by supersaturation of urine with calcium phosphate. Calcium phosphate stone tend to form in alkaline chemistry, and in this type of renal stone, we need to avoid foods that is high in calcium, such as milk and dairy products. So third one is calcium phosphate stone. It is caused by oh no, sorry. Third one is strivite stone. It is caused by urea splitting bacteria such as Staphylococcus, Klebsiella. It is more common in men. Women than the men because of UTI. Then fourth one is uric acid stone. It is caused by excessive dietary purines or GOT. Uric acid stone tend to form in acidic urine. In this type of renal stone, avoid such purine sources, for example, meats and gravy Hello, ma'am. Hello.
Yes, you can go on.
Uh, Risk factors, previous history of renal calculi, immobility and sedentary lifestyle which increases disease, then dehydration which leads to supersaturation, and high mineral content in drinking water, a diet high in purines, oxalates, calcium supplements, and animal proteins. Then prolonged indwelling catheterization, neurogenic bladder, then history of female genital occurs in the formation of crystal form of a solution in which molecules become arranged in a pattern characteristics of crystalline solid. Then aggregation occurs, means that solid things forms into a cluster. Then retention of urine occurs and substance growth and stone forms. Now, clinical manifestation. Severe pain in the side and back below the ribs, and pain that spreads to lower abdomen and groin. Then pain that comes in waves and fluctuates in intensity. The pain on urination, cloudy or false smelling urine. Then nausea and vomiting, fever and urine. Evaluation. First one is collection of family history and history of previous episodes of stone formation. Then second one is CT scan. A CT scan may be used to differentiate a non-opaque stone from a tumor. Then ultrasonography. Ultrasonography can be used to identify a radiopaque or radiolucent calculus in the renal pelvis, calyx, or proximal ureter. Then it is less useful for when attempting to locate stones trapped in the mid-ureter. Then intravenous pyelogram or retrograde pyelogram. It is used to localize the degree and site of obstruction or to confirm the presence of radiolucent stone, such as uric or cystine calculus. Then intravenous pyelogram should be performed in patient with renal failure. Is retrovision analysis of stones are important in the diagnosis of underlying problem contributing to stone formation. Then sixth one is the patient's serum calcium, phosphorus, sodium, potassium, bicarbonate, uric acid, then blood urea, nitrogen, and creatinine levels are also measured. Then measurement of urine pH is useful in the diagnosis of strabismus stones and renal tubular acidosis and uric stones. Then recurrent stone formers should undergo a 24 hours urinary measurement of calcium, phosphorus, magnesium, sodium, oxalate, citrate, sulfate, potassium, uric acid, and total volume. Then medical management. Analgesics, for example, ibuprofen or diclofenac can give. Then spasmodic, for example, Buscopan. Then non-steroid anti-inflammatory drugs, example, steroids. Then surgical management. There are two types of procedures in surgical management. First one is closed procedure. In closed procedure, lithotomy, lithotripsy. It is a procedure that uses shock waves to break up stones in the kidney and parts of the ureter. After the procedure, a tiny pieces of stones pass out of the body in urine. Then second one is percutaneous nephrolithotomy. Uh, it is a procedure used to remove kidney stones from the body when they can pass on their own. Then a scope is inserted through a small incision in the back to remove the kidney stone. Then open surgical procedures. Uh, First one is ureteral lithotomy. It is the open or laparoscopic surgical removal of stone from the ureter. Then cystoidomy. It is a urologic procedure to remove or bladder stones. It is typically performed for patients with large inward bladder stones, or if an endoscopic approach has not been successful. Then pyelotomy. It is a procedure involving a bone in the diagnosis. Indications for pyelolethotomy include minimally branched Stefan stones in the renal pelvis of complex collecting and excessive morbidity. Then last one is a partial or total nephrectomy. This procedure also called as kidney clearing surgery. Nephrectomy is a surgical procedure to remove all or part of kidney. Now come to nursing management. Nursing diagnosis, acute pain related to irritation and spasm from stone movement in the urinary tract. Nursing interventions for this diagnosis: assess the characteristics of pain, advise patient to take adequate rest, advise patient to increase fluid intake, then use heat application for pain, then give antispasmodic and analgesic for pain. Then second nursing diagnosis is impaired urinary elimination related to trauma or blockage of ureter or urethra as manifested by increased urinary output. Then nursing interventions for this diagnosis are monitor patient for signs and symptoms of urinary obstruction such as oliguria, then administer fluid orally, interventions to reduce concentration of urine, then assist inadequate mobilization to help stone come out, and monitor for signs and symptoms of infection. Then third nursing diagnosis is effective therapeutic regimen management related to drink 3 to 4 liters of fluid daily to flush the urinary system. Then encourage the client to drink a full glass of water every hour during the day and 2 glasses just before going to bed. Then teach the client about the measures to prevent stone recurrence, such as diet modifications and medications if required. Then fourth nursing diagnosis is risk for injury related to post-operative complication. Are assess any hemorrhage, stone retention, urinary retention, or infection. Then increase the client IV fluids daily as prescribed by physician. Then maintain client's urine output. Then fifth nursing diagnosis is anxiety related to patient open up about previous experience and health issue, then encourage the patient to tell then physician about the medications and treatment he is taken in the previous hospital. Then provide adequate knowledge about the disease and treatment. So now comes to the complications. Complications of renal stones are stomach ulcers and infections and sepsis, urine importance. Avoid protein intake. Usually, protein is restricted to 60 grams per day to decrease urinary excretion of calcium and uric acid. Then, a sodium intake of 3 to 4 grams per day is recommended. Table salt and high sodium foods should be reduced because sodium competes with calcium for reabsorption in the kidneys. Then avoid intake of oxalate containing foods, for example, spinach, strawberries, tea, and peanuts. Then of water at bedtime and an additional glass at its nighttime, awakening to prevent urine from becoming too concentrated during the night. Then avoid activities leading to sudden increases in environmental temperatures that may cause excessive sweating and dehydration. Did you guys understand about renal stone? Hello?
Yes.
Hello?
Yes, we are listening.
So can anyone tell me the clinical manifestations of renal stone? Hello?
Severe pain at both side and back.
Yeah. And
Pain that spread to the lower abdomen and groin, and nausea and vomiting, fever.
okay, thank you. And can anyone tell
most of the time your voice is breaking. I think your network is not so stable. Okay, if the college reopens practically, we'll discuss this in the class. Okay, how the stones are formed, the types of the stone, your strobite stone, oxalate, and then uric acid stone, okay, calcium oxalate stone. So once the college reopen, we'll discuss it in the class again. So I think all of you have understood, no, about the formation of renal stone.
Yes, ma'am.
Yes.
I'll send you a link, okay?
Yes, ma'am.
From that link, you can go through the video, and then it is like explained very easily there also. So, Himangiri, your presentation is done, seminar done. Conclusion, have you told already?
Ma'am. No, ma'am, not done yet. Conclusion. Conclusion, urinary calculus is increasing burden in developing countries with urbanization. There is limitation the management due to limited sources. Most presentation in our environment are infected, mainly of treatment. Mainstay of treatment in most developing countries still remains surgery.
So the
Done.
prognosis of renal calculi is good, okay? So once you go through this nephrolithotripsy and nephrolithotomy, the prognosis are very good. Okay, so Wednesday, one of your friend is presenting 4 to 5. Okay, I think all of you must be aware. So all of you must be present there in that seminar again. I think CR, all of you are present, no? All 40 of you. Now I can see only 38. Anybody is absent?
Yes, ma'am. No, ma'am.
No, everybody is present, no?
Yes, ma'am.
Okay,
Yes,
then.
yes, ma'am.